Hello and welcome to the Pink and Equine Poor Performance in the Dressage Horse webinar. This is intended to be a relatively concise overview of the topic. We will look at the areas highlighted in more detail in subsequent webinars. To begin with, we have to ask ourselves, what is poor performance? And in simple terms, it's the failure to attain the desired level of performance that one would have expected or hoped for from the combination of horse and rider. This can obviously happen for a variety of reasons. There can be rider issues, there can be horse issues. For the purposes of today, we'll limit ourselves to looking at the issues related to the horse. And initially we have to say that not all horses have the ability or temperament to perform at high level, and an unwillingness to perform does not necessarily equate with a pain-related problem. But again, for the purposes of the webinar, we will look at sort of those scenarios or conditions that can cause pain and discomfort in the horse and can limit its performance. What are the principal medical causes of poor performance? When asked to examine a horse with poor performance, then we must be careful to approach it with an open mind and in a methodical manner. The principal body systems that we find most frequently cause poor performance in the dressage horse are the musculoskeletal system, the gastrointestinal system, the cardiovascular and the respiratory systems. That's not to say that we won't occasionally find issues with other parts of the horse than those listed, but those would be the most common locations or sources of discomfort. And so when we're looking at a horse with poor performance, we have to have a standardized approach initially to examining the horse in its stable, and then subsequently seeing the horse walk, seeing the horse trot, seeing how the horse responds to flexion tests of its fore and hind limbs, seeing the horse lunged on a soft surface. If there's a suitable area, we'll see the horse lunge on a hard surface, and then of course we'll see the horse ridden. And this combination of these initial examinations will often point to a particular area that may highlight a lameness, and we can go down a sort of particular route of nerve blocking and ultrasound or x-rays subsequently, or it may put us in another direction that would lead us towards examining the gastrointestinal tract, so looking at the horse's teeth, examining the horse's stomach for the presence of ulcers, or going down again a different route, looking in the horse's lungs in case of a sort of a persistent cough or sort of nasal discharge. So we have to be adaptive to what the horse shows us as we are examining it, but we do also have to bear in mind that poor performance can be caused by more than one problem simultaneously. So for example, we also now know that many horses with gastric ulcers will have a degree of lameness or other discomfort, and it's very hard to get on top of and to successfully treat the gastric ulcers unless we have also removed the other source of discomfort. So when we consider the musculoskeletal system in the dressage horse and pain that may emanate from it, we are particularly thinking of those conditions that almost stem directly from the job that we ask our horses to do. So when training and competing a dressage horse, particularly at upper levels, we routinely subject their joints, their tendons, their ligaments, their neck and their back to demands which would be beyond those considered physiologically normal. So we're asking, the horse to bear all of its weight through a particular leg or combination of legs for relatively extended periods of time. We're asking it to perform certain movements that will cause torsion, twisting in the back and also in the limbs, and these are obviously not, strictly speaking, movements or actions that the horse has necessarily evolved to carry out in its sort of natural existence. And as a result of asking our horses to do these different actions, these different movements, and subjecting them to the work and the training that is required to reach the highest level, this inevitably will lead to wear and tear developing in different parts of the horse, in sort of different joints, in ligaments, in tendons, and that can lead to pain and discomfort, leading to a subsequent drop-off in performance. And this is where the examination comes in to highlight the areas, the particular limbs or areas of the horse which are not performing as well as they should be, and then to narrow that down further into specific structures, which we can then assess with ultrasound, with X-ray, with MRI scans if necessary, to really dig down and find out what the exact sort of diagnosis and cause of the poor performance is, and thus subsequently how best to manage it. So here we see two examples of arthritic joints from dressage horses. I've chosen two relatively advanced examples of arthritis. It's hard to show subtle symptoms, subtle findings in a medium such as this, but down here we see the distal intertarsal joint and below it the tarsal metatarsal joint. These two joints are the principal sources of pain and discomfort in the hock region, and these are the two joints that are affected by spavin or osteoarthritis. And in this radiograph you can see that the joint space of the distal intertarsal joint has been almost completely obliterated. It's become narrowed or in fact completely lost, and as the arthritis has advanced, the cartilage between the bones has worn away and these two bones have started to fuse together. And when those bones fuse completely together, that joint will actually cease to exist and become pain-free. But unfortunately that is a relatively lengthy process, so we frequently find ourselves medicating the tarsal metatarsal joint and the distal intertarsal joint to alleviate lameness and discomfort. And again, the hock pain coming from the hock can lead to sort of secondary discomfort elsewhere. So painful hock joints will often result in discomfort from the suspensory ligament, which begins immediately adjacent to the hock, as well as also causing sort of secondary muscular and soft tissue discomfort in the back, as it really affects how the horse stands and the horse bears weight, and that can lead to secondary pain elsewhere. Here we see a very arthritic fetlock joint. We've got this mottling around the margins of the bone, the insertions of the joint capsule. These should be nice smooth margins. We've got osteophytes, so new bone has developed as the body seeks to sort of tighten up the joint capsule and retain or improve joint stability. So these are two sort of obvious causes, if you like, of poor performance. We wouldn't often necessarily see joints as in such an advanced form or in such an advanced state of degeneration, but it's an example of where joints can end up if not identified sooner, and if we don't sort of take the steps required to try and support the horse and modify the disease process. So here we see a case of kissing spines or impingement of the dorsal spinous processes, quite a severe case. We can see that the dorsal spinous processes are overriding or rubbing up against each other, and that's causing all sorts of reaction. There's sclerosis, sort of increased whitening in the processes, where the body's reacted by laying down a greater degree of mineral content to try and strengthen the bone. But at the same time, you've also got areas of lucencies, these sort of darker areas where mineral content has been removed from the bone, making it somewhat less dense, And that's all part of the sort of the reaction as the body's trying to sort of deal with deal with the situation that's developed. As I say, this is an advanced case. We often would not see symptoms as or radiographic signs as bad as these. And depending on the severity of kissing spines, then we can look to manage it in a variety of different ways, principally medication both within the back and not uncommonly in the hind limbs and the hock joints to enable the horse to support itself better. And that medication will help to, in the short term, alleviate the soft tissue discomfort that's associated with this bony pain, and that then enables us to work on the horse's muscular strength and improve its top line, which serves a sort of a protective and supportive function for the back. If that's not successful, or if the symptoms are relatively advanced, then we can consider a surgical approach as well, and there are sort of several different surgical techniques that you can use to manage this condition. That's sort of beyond the scope that we have to discuss today, so we will look at that in more detail in a subsequent webinar. Moving away from the musculoskeletal system, here we have an example of some gastric ulceration. This was within an 11-year-old warm blood dressage gelding who was working at PSG level, and he had shown a sort of a change in demeanour. He'd become difficult to girth up, he'd become sort of difficult and sort of occasionally attempting to bite or lift a leg when he was having rugs put on, and he'd had a sort of a marked drop off in performance. So that led us to an initial examination. He looked perfectly sound when he was ridden, London flexion tests. So again, that in conjunction with the symptoms that he was exhibiting led us to perform a gastroscopic examination, which revealed these ulcers. So just to orientate yourself within the stomach, we've got the esophagus, the entrance from the esophagus into the stomach here. You can see the endoscope coming through it. And this sort of pale pink area is the non-glandular portion of the stomach, so this is almost an extension of the esophagus. And then beneath that you see the darker pink area, which is the glandular portion of the stomach, which is the part of the stomach that releases stomach acid, among other things. And then looking at the border between the two, the margo plicatus, we see this reasonably extensive areas of ulceration, which were the source of this horse's discomfort. This horse responded well to a course of oral Gastrogard, administered a syringe a day for a month, and when he was subsequently re-scoped, his symptoms had gone, as had his ulcers, and he's now sort of back performing at his previous level and doing well. We also see cases of respiratory disease in horses very frequently, and as we've seen in the equine and human worlds in the last few years, infectious respiratory disease is prevalent. So we've had the influenza outbreak, we've also had the equine herpes outbreaks, and obviously we're all currently dealing with coronavirus. So horses attending competitions are certainly at risk of acquiring an infectious respiratory disease, and we should endeavour to do what we can to minimise this risk. So it's not to say we shouldn't go to the competitions, but we should make sure that we are up to date on our vaccination schedule. We should also make sure that our biosecurity is good, so we shouldn't be allowing our horses to mix with other horses unnecessarily at competitions, and you should try to avoid having direct contact with someone else's horse and then immediately contacting your own horse, unless you've at least washed your hands between horses. And so that's, I'm sure, as we've said, hand washing and biosecurity are now sort of top of many of our priorities. So that will certainly help minimise the risk of passing on infectious respiratory disease in the horse. Equal importance, or of equal sort of importance in regard to poor performance, is the cases of inflammatory airway disease in the horse, also known as equine asthma, and that can be a frustrating problem to have to deal with. It can present as a cough, as a nasal discharge, as a sort of a drop-off in exercise tolerance, and that can be triggered by certain environmental factors such as sort of dust or pollen, sort of sensitivity to those, to certain molds or fungi that may be present in hay or in stables. It can be difficult and frustrating to get on top of. Obviously there's the initial diagnosis, which normally requires an endoscopic exam and a sort of a tracheal washer sample of fluid taken from the horse's airways, which can be analysed in the lab. And then we have to manage the horse's environment, so reduce the dust as much as possible, and also administer certain drugs, whether that's systemic or inhaled therapies, nebulized therapies, which can help us get on top of the situation and limit the symptoms. Which, if your horse is coughing midway through a dressage test, that's certainly a distraction and not going to help our aims of performance. Cardiovascular disease is less frequently an issue in horses, but it is occasionally found, and as such we should bear it in mind. Horses' heart rates will increase from between 30 and 40 beats per minute at rest, up to about 120 to 150 beats per minute in competition, and consequently also in training as well. And as such, a disruption to the heart's normal rate or rhythm will limit the horse's ability to exercise and cause a decrease in exercise tolerance. The different conditions that arise can normally be found initially by auscultating the heart, so listening to it with a stethoscope and listening to the normal, listening to the rhythm, and also listening to the different heart sounds, which will highlight whether there's a particular alteration in blood flow, such as would be caused by a heart murmur. And if something like that is found, then the heart can be looked at using ultrasound, or it can be assessed using an ECG. Thank you for watching the webinar on poor performance in the dressage horse. It's my intention to follow up this webinar with subsequent ones where we will examine in more detail the different areas we've highlighted today, so musculoskeletal issues, gastrointestinal issues, and cardiovascular and respiratory issues. So we will produce those and release those in due course over the coming months. If you have any follow-up questions to this webinar, or any suggestions for topics you'd like to see covered in more detail, then please don't hesitate to get in touch. My email address is rich@pinkhamequine.com, and equally, if you and your horse are within the areas that we cover, so Hampshire, Wiltshire, Dorset, very occasionally further afield if sort of requested, then again please don't hesitate to get in touch and make an appointment with us. You can find our contact details on the website at www.pinkhamequine.com, and you can also follow us on Facebook, Twitter and Instagram. Thank you. Goodbye.